Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. I want to make this video and call it Don't Be Bill McMahon I don't know what we're up to, 4 million, because he is probably one of the most prolific misinformation spreaders that there is. He likes to denounce me, calling me names and whatever. I think it's going to get to me, but it really doesn't. What it really shows, unfortunately, is that a man who wants to be a leader, who could have been a good leader, unfortunately prefers to spread misinformation for clickbait. So let's break down into some of that. He has a very large group in Florida and Southwest Florida, mostly retired sergeants and police officers who are very angry because the Emblem Health GHI CBP plan hasn't been serving them for decades. And he's right on that. It hasn't been. And where the unions could have created a national network, even by region, where there is a large population of retirees at $3 million a region, through the Municipal Labor Committee's stabilization fund. They chose not to. And we have all those documents. I've been doing healthcare for 30 years. I understand all of this, and we have the records to back up what we're saying. This is why we've been so successful. But Bill, unfortunately, now is taking a different position. If you remember, over the last several years, he was attacking us and trying to force Medicare eligible retirees into a Medicare Advantage plan because he felt if Aetna took over the entire book of the city's business, because I guess his wife was an Aetna sales rep, account rep for the city of New York, that they would take over the entire book of city business, both active and Medicare retiree and non-Medicare retiree. So if Aetna took it all, then he wouldn't have to be paying a couple $1,000s a month for his Aetna EPO plan. If he's on Medicare or she's on Medicare, I don't remember which one, the other partner then was in the GHI plan, and there was no providers in the vicinity of their home in Cape Coral. So here's a problem. After we started to win our cases, and he was beating me up and wanting Aetna to take over the plan for all the city of New York and force Medicare retirees into a privatized alternative to Medicare and managed care, which most of their doctors and hospitals did not accept, he was trying to kill Emblem in order to protect Aetna. Now you have the opposite, where he's not looking to, what he is looking to do is now protect Emblem United Healthcare's alliance in creating a national network, which is fine. And we've not come out against the plan. We've come out against the lack of transparency. And this is where Bill is wrong again. So we have said from multiple videos that if what they're saying on the face of this plan is actually accurate, then that's a good thing because it provides a network to a lot more people. But at the same time, he made posts today or yesterday on his Facebook page. And let me just go over there because I think this is hysterical. And it's also very sad because of the misinformation that he's spreading. So let's break down some of this. And I want to show you some of the things that is also a concern. So right now, Bill Mack is telling people to post on our Facebook page and call our attorney and pressure him not to sue to stop this plan because they finally have doctors that are in the network. But I also want to remind you, as a good leader should, is that a plan has to work for everybody, as many people as it possibly can. And it shouldn't also, just because it serves Bill and it screws like 20,000 other people, that it should be fine. He also needs to know what's in the small print of this plan. So first, let's start with this New York City EPPO plan, okay? One of the documents I want to remind you is the slide deck that came out back in August. Now, this is slide 8, and it says, why Emblem United Healthcare? Keeping our current doctors. There would be virtually, and this highlight is mine, by the way, virtually no disruption in care, which means there will be some people that will be disrupted. And this is why we asked for what they call a disruption report. We wanted to see the data. They denied us. And as members would be able to keep the same network doctors. Now, we started a survey, and the survey is showing that there are many people who had GHI in-network doctors today that will not have GHI in-network doctors January 1st. And that is another reason why we wanted the disruption report. And I'm going to also show you why that's important on the next slide I want to show you. So expanded network, greater access, Emblem Health, United Healthcare would significantly expand our network of doctors. And honestly, that is true because United Healthcare does have a larger network than does Emblem. Proof in point was that here was a group in Florida that has been complaining that they don't have doctors for a couple hundred miles or they have to come back to New York. Okay. Now, if I go to the 13th slide, again, highlights are mine. The PPO must maintain a robust network of providers. At least 90% of all services in the downstate 13 would have to be a network, and 95% outside the downstate 13. Now, let's talk numbers, because this is why I don't like when they use percentages. This population right now is 750,000 people, okay? That would also include your dependents, to my understanding. Now, if you say that approximately 400,000 people, because the city's network is about 350,000 active workers, let's talk about the 400,000 that are not. Well, you're talking about 5% of those people, which would still be 20,000 people without a doctor. So while Bill is really happy because Bill has doctors today, there's 20,000 people that are not happy, that have been looking up at the tools, that are not seeing their providers. Now, we knew that the very first day that they revealed this tool, that the tool was broken because it wasn't working. And that shows another level of ineptness that we've been complaining about for years. Emblem's website and their portal has still been inaccurate. I mean, there's a lot of things on the Medicare portal side for senior care that's still inaccurate, and they haven't corrected. Now, in saying that there are people that won't have access, but more people do, this slide is proof in point once again that you're talking about a large number of people that won't have access to in-network care. And what does that mean? That just doesn't mean a copay. That means high cost because they are purely out of network. And the reimbursement rate is what Medicare pays, which means they are going to have coverage by an out-of-network doctor, but the reimbursement is very small. And if they find a doctor willing to allow them to pay them as a cash payer, then they would have a very large medical debt on their own. So while this does help a large majority, don't be fooled by the numbers 90 or 95, because, like, for example, if we take that 400,000 retiree number and we put a 5% on that, like I said, is 20,000 people. If you do 350,000 people times that 90% of the downstate 13, so that's 10% of the people, you're looking at 35,000 people in the New York metro area that don't have a doctor. That's 35,000 people. So you're happy because it serves you. And once again, this was the same issue that Bill did with Medicare Advantage. He was trying to get Aetna to take over the entire book of business so that he would no longer have to pay premium because he chose to move to Florida. So he was okay with screwing everybody else not to have a doctor because he had a doctor. That's not leadership, okay? Let's go into some more misinformation that Bill has been spewing on his Facebook page, because this is what creates conspiracy theories. I mean, he can hate me all he wants. However, he says that we intentionally send you to the wrong site. No, we sent everyone to the official site. Now, when you want to say that an organization or the city of New York or this NYCE PPO plan is doing something that's negligent, you send them you follow according to the official rules. The official rules tell you to go to the official website. You go to the official website and you use the official tools. The reason why you have people on the page like Mr. Weiss or Chris telling you to go to the specific network that's mentioned once in the contract, the reason why you can't do that is because when they negotiate these plans, they customize the national networks. They did it for Aetna Medicare Advantage. They did it for this as well. So you cannot tell people to just go to United Healthcare's network and go look up your doctor on United's United Choice Plan. You have to use their tool because the tool is the official place to go as per the directions to look for your providers, which is why we've been urging them to fix the tool. If this also goes back to another issue. Insurance companies are notorious for ghost networks. So if you don't hold them accountable to the one place you're supposed to go to find all of your providers, then they can have a ghost network. And guess what? We're already finding dead doctors or doctors that left the GHI network that are not going to be in this plan in the tool. So this is why it's important to go to where they're telling you to go. We've gone through the contract. We know where you're supposed to be going. And the official guidance off the OLR website is to go to the official website of the plan. Click the link, search the doctors. They've already updated it once, and they've updated it a second time. They just didn't tell you that they did. But that's what they're doing. Now, he also says that we pad our pockets with donations. No, we don't. Our organization fundraises to fund its missions, which is majority of our expenses is for attorneys and accountants and bookkeepers, our lobbyists, and etc. So none of us get paid. Nobody. We have a board, we have an advisory board, we have trustees. No one gets paid, and no one's padding anything. Let's see. He also says this group has unsuccessfully tried to sue in court and at the end, just like I predicted, that we lost. No, we didn't. We've won 11 different times in court. First case, Campion, all the way up to the New York State Court of Appeals with the unanimous appeals decision in 2 courts. Then the copay case is still active. We didn't lose that case. And if you don't know what the copay case was about, the why we were able to stop the copays was because of a contractual breach. There was a contract that didn't provide for copays. We knew we would probably never be able to stop them. And this is why it's important to be in the know. You guys just choose to follow Bill and start like barking attack dogs on whatever his missive is of the week without learning the facts. We knew going into this, we may not be able to stop them forever, and we may not be able to roll them back. We were able to stop them successfully in 2022 because the contract that was in place that they never updated did not provide for copays on Medicare senior care. Then they were paused in 22. We didn't pay them for 23. We didn't pay them for 24. They re-implemented them in 25. Why? Because they changed the contract. That's not something you, me, Bill, or Jesus at this point have an ability to change. The only way we can do that is legislation, which is why it's important to try to get that aspect done. Why? Because the MLC leadership keeps going to the table and negotiating your healthcare away to finance their raises. So if you understood why things happen, then maybe you would actually take a more proactive position in helping us win our fight because it does benefit you than be antagonistic. The third case was Benkowski. We won in Supreme Court. We had a unanimous appeals decision. The mayor appealed again. We argued on 13 different causes of action is what we sued, but we did not argue on all 13. Why? Because the judge in the Supreme Court decided he was going to solve the case on one of the 13 and felt that that was sufficient and didn't need to re-argue all the others. And so on that one decision, one cause of action, the court found for us unanimously, and then the mayor appealed and sent it to the highest court in the state, the New York State Court of Appeals. We lost at the appeals court. Why? It's a politically appointed court. And if you listen to the argument, one of the judges was more concerned with what would happen if promises were made to other municipal retirees and they decided to sue their municipality, would they have to keep hearing these cases? He was telling you right there, they didn't want to deal with the city breaking its promise. So they overturned it and sent it back to the Supreme Court. We're still in court on the other 10, 12 causes of action in Benkowski. We didn't lose. And the reason that the mayor made the decision where he walked back the MA plan was because he was running for election and didn't want to come out like he was attacking retirees or stealing their health benefits when he was trying to win your vote. The court sending that case back to Supreme didn't overturn any of the findings of the lower court that this would be a diminished plan. Many doctors and hospitals wouldn't accept it, and that retirees wouldn't have access to care and would end up spending more money to get that care. All that stays. So no, we didn't lose. And that's also shame on Donna Iannici Hildebrand for saying the same thing. You don't know what you're talking about. And that's why it's important to follow. You're in our page lurking, like, skulking around, but you're not reading the facts and you're not listening. You're just there for what purpose, I don't know, because you're not educating yourselves, and you actually could be. And you could be bringing information back, but the reason why you don't want to bring that information back to your circle in the NYPD page is because you're afraid Bill will probably delete you from the page if you speak out that he's telling a lie. So you just go along and drink the Kool-Aid. That's very dangerous. Let's see. He also says, led by some lunatic that allegedly illegally trespassed a Broward County 1013. If I remember correctly, we were asked by Alan to put out that email that he was inviting all municipal retirees to that Broward County meeting. That flyer that Alan Berkowitz sent out went to everybody. And any municipal retiree, because you were trying to sell Aetna Medicare Advantage plans to everybody. You wanted everyone to hear Sabrina. So all the retirees that got that, some came from afar to listen to Sabrina. That's what you wanted. And when I got the call from Alan Berkowitz that he wanted to make sure that retirees heard her because he was frustrated that his own care was meeting resistance and he had to get her to push it through. You don't even know all the facts. And that's what's scary. Alan Berkowitz, before he passed away, called me and said, "Keep fighting, kid. You're doing the right thing. They have to know." So I did not know Alan was sick until he called me. And then I think it was a week later, he had passed. And in that memory, I'm going to keep doing what he said, because he realized pushing this in his friendship with Sabrina was wrong. But the rest of you don't seem to care. While that plan works for you, it works for you now, and you're welcome to keep it. But you should not be forcing people into a plan that doesn't work for them. End of story. He said, if a TRO is introduced again after this delayed, then it will be finalized after Adams leaves office, and it will be left up to Mamdani to decide the fate of our healthcare. A number of people, now that's another interesting fact. The unions negotiated this plan to be 5 years. Mamdani, if this goes through now, Mamdani will have absolutely no ability to modify it, because he's got a contract for 5 years and he'll be in office for 4. Unless he gets reelected. A number of people that are stuck paying for Aetna due to medical issues and no availability of doctors can't afford to pay $3,000 a month. Look, dude, you chose to leave. You chose to move out of New York, and you chose to be on an Aetna plan. And you chose not to hold your union accountable to make sure that you had doctors in Florida. We decided to take a different path and hold the city and the unions accountable to make sure that we had coverage. We did that. You walked away. Do you remember? Because I still have those text messages from 2021. You had every ability to be on this organization, to be part of this team, and you chose not to. And then you chose to attack us. And you were angry because the board wasn't consisting of all cops. You were never going to get anywhere with the board of all cops. The city council does not favor police officers. And you also want the body of your organization to resemble your organization of the people you represent. Police officers, my friend. Also, you need to remember, the city and the MLC committed to $1 billion in savings in this round for this deal. They committed to $600 million in recurring savings in the 2018 deal and $1.1 billion in savings in its entirety in the 2014 deal. They did that by increasing copays, suppressing the HIP benchmark, adding more prior authorizations, and deductibles. They also have managed care. When your health care gets to a certain dollar amount, then they will have a managed a healthcare. I forget the name of it. It manages your care. When they identify that you're a high spender, they then get involved in your care to make sure that your care dollars don't continue to skyrocket. They're managing you. You don't know that because you didn't read the contract. And the reason I know that is because there's about 40 pages that are redacted that you never saw or questioned. So there's nothing that you can see that will tell you that this plan is guaranteed for 5 years with no premium, that this copays are guaranteed for 5 years. And I could understand you haven't had a doctor nearby and you've been paying out of pocket or flying back to New York, which is costing you a fortune. So you don't really give a damn at this point if you have copays of $15. But I'm going to tell you something. We have to take into consideration all retirees. You have police officers, which is your most important group of workers who make low pensions, like $26,000, and they're Medicare retirees. What you didn't take into consideration when you were trying to force them into an Aetna Medicare Advantage plan was if their doctor or hospital didn't accept that plan, they were out of pocket for their medical costs. And at a $26,000 pension, they couldn't afford that. You are only worrying about you based on your pension. We have to worry about everybody that doesn't make the kind of income you do. And that's what separates us. We look out for everybody. You are only looking out for you and your population, police officers. So we have to keep looking and keep making sure that we're asking for transparency. We haven't attacked this plan and we haven't said we're suing. We're exploring all of the options that are available to us if the city is refusing to give us the information. Why? Open enrollment is November 1st. You are supposed to be able to make a decision on a healthcare plan before November 1st because it closes on the 30th. And if you don't have a summary plan description, a summary program description book that talks about all the plans or all the details of this plan, or know if your doctors are going to be in the network, because we're already getting calls that retirees that live in New Jersey, for example, who used to have doctors in Emblem are no longer in Emblem, and they're not in the United network either. So that is something we have to take into consideration. And if this plan doesn't meet the $1 billion savings that they promised, since they decided to reach for the moon, where is that savings going to come from? And if it's not realized, what happens? Because in the Medicare Advantage construct, when the $600 million was recurring, what did they do? The city of New York sent a letter to the Municipal Labor Committee and said, just a couple months ago, hey guys, you owe us $4 billion. And they were going to force them to arbitration to pay $4 billion. So where was that going to come from? Union doesn't have that money. It was going to come from its members. So the MLC decided to sue the city to block the forced arbitration over the 14 and 18 deal. In order to save not having to pay that money, they had to agree to do this, an RFP on the active worker plan. The language of the contract allows them to make changes to the plan in costs, not design. They can, if they realize medical costs are going higher than they predicted, then they will assess more copays, deductibles, add more prior authorizations, and cost transfer comes to your wallet, Mr. Bill. And this is what we've been fighting for. It's called transparency. Right now, you don't understand what prior authorization is. We do. And if United Health, if you know anything about United Healthcare, they are one of the worst purveyors of healthcare prior authorizations and the highest amount of denials. Then comes like Aetna. But they are very well known for denying prior auths. I mean, you have Dr. Potter from Texas, who's been talking about, she was doing surgery on a woman for breast reconstruction after cancer, and the patient was literally on the table, and United Healthcare called her out of the surgery to tell her, we're not paying for this. So if you don't know what the prior authorizations are and how often they can be changed and by whom and what triggers that, then you're basically signing a blank contract. And I don't think any of you, for as smart as Bill believes his wife Andrea is, I don't think Andrea would allow Bill to sign a blank contract to purchase a house or a car. So this is a blank contract. You have only 100 something pages that are visible and the last 40 pages are not. And that's where the financial information is that uncovers exactly what triggers all of the bad things that they promise that don't happen. That's what we've been fighting for. We want transparency in the network, transparency in the prior authorizations. You're entitled to that. And while you're very happy that it has a larger network, as are we also need to know how that can change. And how will you know? And if the costs rise, what triggers it? How quickly will you be notified? Who has the ability to change those copays, deductibles, and add more prior authorizations? Because right now, you don't know that information. So while you may want to attack me, your Steve Weiss's and Donna's and Bill Mack's and Alan Capruccio and whatever, you guys just have no idea what you're talking about. And I really strongly advise you, if you're going to be on our page, then you should learn what we're saying and why we're saying it. We're not attacking you. We're trying to help you. And we're trying to preserve your pension dollars from going out the window on something you didn't expect. Because then what'll happen is if I don't do that, Bill will be back on his page going, why didn't she ask about this? Well, now I can say, I told you so. Because this plan will probably go through unless someone else sues to stop it. And it has to go to the comptroller, I believe, after tomorrow. And he has 30 days to register this contract, which I don't think he's going to find anything to not do it. But even if he does, the mayor can override it because it's a negotiated acquisition. Here's another little quick fact. When this program, the 2022 RFP came out for this NYCE PPO plan, it was going through a negotiated acquisition process that was filed through the Procurement Policy Board under specific rules. And it had to go through a public hearing and then goes to the comptroller. Well, that was in 22 when this process of RFI and then RFP, request for information, turned into a request for proposal in June of 22. And then they started this process. They've been working on this since June of 22. Now, a recent rule change in the Procurement Policy Board rules in March was submitted. It was changed May 2025 that allows the city to do these procurements without an open public hearing. They just have to do a public comment period by email only. It's not transparent. And then that information that people submit never gets made public ever. Everything that could potentially have been aired about people's grievances with whatever contract that goes through an NA process is now hidden in darkness and lacking democracy. And that's what the Mayor's Office of Contracts, the Procurement Policy Board did. The City Council didn't even know. So you should be happy that there's someone looking out to make sure you're protected. And don't fall for some guy that you think is your hero telling you that we're just a shill or lining our pockets. We're literally trying to protect you, whether you realize it or not. So, listen, guys, you're either going to believe it or not believe it, but I'm going to tell you, stop calling our attorney. Stop trying to interfere. No one's trying to hurt you, and that's not the narrative. You've been hearing from us, we want transparency. You've never heard me say we are suing. You've always heard me say we're exploring our options or the legal options available to us because they're not giving us the legal information that they are required to. That 2 courts in the past have told the city that they stopped the plan in place because they did not give us the things that we were required in order to make a decision before open enrollment. Be glad someone has your back because you're only seeing the one benefit, the carrot dangled in front of you, that it has a larger network. And you didn't even think about all this other stuff that I've been talking about for the last 30 minutes. And maybe still at this point, you don't give a shit. But there are a lot of people that do. And yes, of course, it did cut out the widows. And many of those widows, those line of duty widows, don't have the money to be able to sue the city of New York. And why would you make them sue for something when we are supposed to be looking out for them and taking care of them. So I'm sorry, but Bill's comment that the widows and children not being included is an excuse is deplorable. Our job was to look out for them and not make them fight for themselves. The widows and widowers and those children lost their parents in the line of duty. And it is our job to make sure that they are protected and not send them to fund themselves. And if that's your position, Bill, you're even uglier than I thought you were. All right, everyone, I'm going to wrap this up. Hopefully you've learned a little bit of something and realized we're not crazy and we're not what Bill's making us out to be. And if you still think we are, well, then I'm never going to convince you. But just know that someone actually is looking out for your pension and your well-being. Because I'm already telling you that there's lapses in this plan that you are completely unaware of. And one day they'll come back to bite you in the ass. And all we're looking is for transparency. Have a great evening.
Don't speak what you don't understand. The truth is not in your command. Don't shout about what you think is fake. The decision isn't yours to make.